my name is Melina Santos, and I'm going to be doing my head to toe for the Women's Health Summer 2024 class. This is my patient, John, and here is my surroundings, the floor, the walls, my patient, some of the equipment I'll be using, and the ceiling. Okay, so to begin my head to toe, I'm going to begin by assessing the skin of the face and neck, the posterior and anterior chest, and the abdomen. I'm going to be looking at the skin color, the texture, the temperature, moisture, edema, and turgor of the skin. I'm also going to be looking for any lesions, any bruising, scars, and nevi. And then I'm going to assess the face or the head shape, size, and I'm going to be palpating the scalp for any depressions, any tenderness, any lesions, any masses. I'm going to be looking at the hair color, the texture of the skin, the texture of the hair and distribution of the hair, as well as looking for any infestations. And then I will palpate for any tenderness in the temporal arteries, any tenderness there. And then I'm going to palpate the lymph nodes, beginning with the preauricular, the postauricular, the occipital lymph nodes, the tonsillar lymph nodes, the submandibular lymph nodes, the submental lymph nodes, the anterior cervical and the posterior cervical lymph nodes, and the supraclavicular lymph nodes. Okay, and now I'm going to be assessing the TMJ joint. So can I have you open and close your mouth? Okay, I'm feeling for any crepitus or subluxation. Did you have any tenderness with that? No. Okay, and now I'm going to be assessing the cranial nerve number 5, trigeminal. So I'm going to have you bite down for me. Perfect. So that is the sensory portion of that cranial nerve number 5, and now we're going to do the sensory portion. Or sorry, that was the motor, this is the sensory. So close your eyes and let me know where I'm touching you.
Forehead, nose, cheek, chin.
Okay, perfect. And now we're going to do cranial nerve number 7, facial. So I'm going to have you lift your eyebrows up, puff your cheeks out, give me a big smile, pucker your lips for me, and give me a frown. Okay, perfect. And now I'm going to move on to the ears. I'm going to be looking at the ear shape and position, and I'm going to palpate for any masses or tenderness of the pinna and the tragus. Any tenderness with that?
No.
Okay, and now I'm going to look into the auditory canal and look at the tympanic membrane, making sure it's pearly gray and intact, which it is. And then we're going to be assessing cranial nerve number 8, auditory. So we're going to begin with the Weber test. So you're going to let me know if you can hear this in both ears, okay? Or equal or greater than 1.
Equal.
And then we're going to be doing the Rhine test, making sure the air conduction is greater than bone conduction. So let me know when you stop hearing it. Okay.
Okay. Okay.
Okay. And we'll do the other ear.
Okay. Okay.
Okay, perfect. So air conduction is greater than bone conduction. Now we're going to do the whisper test. So can you repeat back to me what I'm whispering?
A, B, C, D.
And now we're here.
10, 9, 8, 7.
Okay. Perfect. So whisper test is in check. And now we're going to be moving on to the nose. So I'm going to be looking at the nose, making sure it's straight and midline, and then we're going to be checking for nasal patency. Let me know if you can breathe in and again. Okay, perfect. Now let me know if you can smell this. Okay, and what does that smell like?
Lotion.
Okay.
Lotion.
Perfect. And now we're going to be assessing the mouth. So I'm going to be looking at the lips, the teeth, the gums, the buccal mucosa, the palate, the tongue, and the salivary glands. Perfect. Making sure all the teeth are intact. No lesions or anything noted. Can you stick your tongue out for me and say ah? Okay, so the uvula and posterior pharynx rose and fell with phonation. So that was assessing cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus. Now we're going to do cranial nerve number 12, hypoglossal. So stick your tongue out for me and move it side to side. Okay, so no fasciculations, and the tongue was midline. And now we're going to move on to the eyes. So without your glasses, I'm going to look at the eyelashes, the brows, the pleural fissure, and then I'm going to be looking at the conjunctiva and the sclera, making sure that the color is normal, which looks nice and white, and no lesions of discharge noted. And then, okay, perfect. So while I have your glasses off, I'm going to assess his eye, checking for the red light reflex as well as any internal eye structures. Okay, perfect. So now I'm going to have him put his glasses back on. And we're going to be checking cranial nerve number 2, optic. Can you read the bottom line for me?
Yeah, LTFPH.
Okay, perfect. And now I'm going to have you cover one eye and tell me how many fingers I'm holding up.
2.
And again.
3.
Okay, and now the other side.
3.
Okay.
2.
Perfect. And now, well, that was cranial nerve number 2, optic, so peripheral and central vision were intact. Now we're going to move on to the neck, and I'm going to assess the trachea, making sure it's midline. I'm going to feel for the carotid arteries, and I'm going to take a listen as well for any bruits. Okay, perfect. And now we're gonna assess the thyroid glands. I'm gonna have you swallow. And again. Okay, perfect. And now we're going to do the posterior chest. Can I have you turn around? Okay, so I'm gonna be looking for any signs of respiratory distress. So any the tripod position, which she's not having, any use of accessory muscles, any tachypnea, cyanosis in the skin, any retractions, none of that is noted. So I'm also going to be assessing the back for any obvious deformities and symmetry. Can I have you take a big breath in and out? Okay, perfect. So that was equal chest expansion. And now I'm going to percuss the lungs in between the intercostal spaces. Okay, perfect. And now we're going to be doing tactile firmitus. So can I have you say the words 99?
99, 99, 99, 99, 99.
Okay, perfect. That was felt equal throughout. Now I'm going to listen to your lungs, so take big deep breaths in and out for me. Okay, perfect. Now we're going to be testing for egophony, so I'm going to have you say the letter E every time I move my stethoscope.
E, 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 E.
Okay, perfect. Now I'm going to test for bronchophony, so I'll have you say 99 every time I move my stethoscope.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. And now we're going to do the whisper pectoraliqui, so whisper 99 every time I move my stethoscope. Okay, perfect. Now I'm going to have you turn around and we're going to complete the anterior chest. Okay, so I'm going to again assess for symmetry in the chest. I'm looking for any deformities, equal chest expansion. Take a big breath in. Perfect. And tactile hermitus, so I'll say 99.
99, 99, 99, 99.
Okay, perfect. And now I'm going to listen to the anterior lobes. Big breath. Okay, perfect. Now we're going to be moving on to the heart, so I'm going to be listening to all 5 cardiac points. The aortic valve, you can just say the pulmonic valve, Herb's point, tricuspid valve, and the mitral. And then again with the bell of my stethoscope. Aortic, pulmonic, Herb's, tricuspid, and mitral. And now I'm going to listen at the apical pulse for a minute and determine his heart rate and rhythm. Okay, the rate is regular, or the rhythm is regular, and the rate is about 60 beats a minute. And now I'm going to feel at the point of maximal impulse. Okay, no abnormalities there. Now I'm going to have you lay down at about 45 degrees to continue the cardiac assessment. So at 30 to 45 degrees, we're assessing any jugular vein distension or pulsations, which I'm not noting any. And then I'm going to feel each of the 5 cardiac points for any thrills. Okay, which I don't notice any, and I'm again going to listen to each of the 5 cardiac points, but laying supine. So, sorry, gonna knock that off there, put you flat. If you could scoot up for me a little. Okay, and again on the other side. Okay, and now I'm going to move on to the abdomen. So I'm going to be looking for any contours and symmetry. I'm going to listen to the major arteries for any bruits. So it's going to be the aorta, and the renal arteries, and the iliac, and the femoral arteries. Okay, and now I'm going to listen to all 4 quadrants of the abdomen. Okay, bowel sounds are normal. And now I'm going to percuss the abdomen. now I'm going to palpate the abdomen for any tenderness or masses. And I'm going to palpate the liver. Take a big breath in. And for the spleen, which is not palpable. Okay, we're going to have you sit back up. And we're going to move on to the musculoskeletal portion of the assessment. So beginning with the joints of the fingers, the wrists, the elbows, and the shoulders, I'm going to be checking for any redness, swelling, nodules, symmetry of the joints on either side, and any tenderness, let me know. Noting any crepitus. Okay, perfect. So now we're gonna do range of motion of the fingers, okay? So we're gonna adduct, and then abduct, and then you're gonna flex them down, and extend them, and hyperextend them. And you're gonna do the, thumb opposition, perfect. And so now with the wrist, you're gonna flex, extend, and hyperextend. And then you're gonna ulnar deviate, and radial deviation. And then you're gonna circumduct, perfect. And now I'm gonna have you squeeze my hands. Okay, 10 out of 10 strength there. Or sorry, 5 out of 5 strength there. Okay, +3 pulses. And capillary refill is less than 3 seconds. And now with the elbows, I'm gonna have you flex them in, extend them, and hyperextend them if you can. Okay, perfect. Now I'm gonna have you pull them up, pull me towards you, and push me away. Okay, 5 out of 5 strength in the elbows there. And then with the shoulders, I'm gonna have you flex them forward, and then extend, hyperextend, and then internal and external rotation one way. Perfect, and now the other way. Okay, good. Now I'm gonna have you put your arms out. And so this is abduction. You're gonna push up against my hands and push down. Okay, there's a shoulder griddle, 5 out of 5 strength. And then you're gonna adduct back down, perfect. And then before I move on to the lower extremities, actually I'm gonna do cranial nerve number 11, spinal accessory. Can you shrug your shoulders for me? Perfect. And then before I move on to the lower extremities, I'm going to do the deep tendon reflexes. So brachioradialis. Oh, sorry. Okay, and then the biceps. And then the triceps. And then the patellar tendon, or patellar reflex. And then the Achilles. And the Babinski. Okay, perfect. So now I'm gonna be moving on to the lower extremities. Can I have you put your feet up here on this bar? Okay, as I'm doing that, I'm also noting the skin of the extremities, including any edema, the color and temperature of the skin, which no edema is noted. So I'm going to begin by assessing the joints of the toes, the ankles, the knees, and the hips. Again, looking for any nodules, any crepitus, redness, swelling, and symmetry in the joints. Okay, so with your toes, I'm going to have you flex them down, extend them up, and hyperextend up if you can. Okay, abduct them, and then adduct them in. Perfect. And then I'm actually going to feel your pulses and your capillary refill down here. So dorsal pedis and posttibial pulses are both 3 out of 3. And now your ankle joints, we're going to have you dorsiflex, so pull your toes up towards you, and then plantar flex down, and then you're going to invert, so an exvert out. Perfect. And then you're going to push down on the hands, and then lift your toes up towards your feet. Okay, perfect. So 5 out of 5 strength there. And then with the knees, you're going to push out against my hands and pull in. 5 out of 5 strength there. And then the hips push out against me and push in. Okay, 5 out of 5 strength there. So we're gonna have you stand up and we're gonna do the range of motion in the knees and the hips. So we're gonna have you flex out. Oh, sorry, let's turn you this way. Okay, so flex out, extend, and hyperextend back. And then abduct, and then adduct in. Perfect, and now with the other side, same thing. Flex forward, extend back, and hyperextend if you can. And then abduct out, adduct in, and then do the circumduct if you can. So twist it, perfect. And now same on this side, sorry. Can you circumduct? Okay, perfect. So now with the hips, we're gonna have you flex your knee forward. Okay, perfect. And then can you extend your hip back? Perfect. And then abduct out. Okay, and now, yep, and then invert in. Perfect. And now same with the other side. Flex forward, and then extend back, and hyperextend back if you can. Sorry. And then abduct out, and then abduct in. Yep, and then you're gonna do the internal and external rotation. So yeah, what you were doing with your knee. Yep, and then out. Okay, perfect. And so I'll have you here, I'm gonna assess the spine. I'm gonna be looking for any tenderness, checking for scoliosis, symmetry in the spine. So I'm gonna have you flex forward and then come up slowly. I'm noting the curvature and the alignment of the spine. Perfect, and now I'm gonna have you flex back towards me and hyperextend, perfect. And now we're going to lateral rotation to the right. So just, oh, okay, or twist and twist the other way as well. And now we're gonna laterally rotate just like this. Perfect, and now the other way. Perfect, and now we're gonna do the same with the neck. So flex forward, and then come up slowly and extend back. Okay, and now we're gonna lateral flexion to the right and to the left, and now you're gonna circumduct or rotate your neck. Okay, any tenderness with any of that?
No.
Okay, perfect. So now we're gonna have you walk heel toe that way. Perfect, and now turn around and walk normal back towards me. Okay, perfect. Now I'm gonna have you stand here and we're gonna do the Romberg test. So put your arms out and close your eyes. And then, perfect, no swaying. Now we're gonna have you hop on one foot and then the other. Okay, perfect. So I'm gonna have you scoot up a little bit. And we're gonna have you sit back down. And we're gonna do vibratory sensation. Let me know if you can feel this on your legs of the.
Yep.
Okay, now we're gonna do it in the wrists, the ulnar prominence.
Yep.
Okay, perfect. Now we're gonna be doing light touch sensation of the upper and lower extremities. So close your eyes and let me know where I'm touching you.
Right arm, left arm, right leg, left leg.
Okay, perfect. We're gonna do stereogenesis and graphesthesia. So stereogenesis, let me know what I'm putting in your palm.
Coin, paperclip.
Perfect. Now let me know what I'm writing in your palm.
An 8,
Okay,
an A is an alpha.
perfect. And now you can open your eyes back up and we're gonna do some cerebellar coordination. I'm gonna have you touch each finger to your thumb as fast as you can. Perfect, and now on your, yep, I'm gonna have you flip back and forth as fast as you can. Okay, perfect. That is the end of my head to toe assessment. Thank you.